Leishmaniasis. Leishmaniasis is a disease caused by the unicellular eukaryotic parasitic protozoan known as Leishmania. Physical characteristics of Leishmania. Overall, the Leishmania parasite usually has the shape of an elongated American football, with well-defined organelles such as nuclei and flagella being noticeable. How does it spread? Leishmaniasis spreads mostly through the bite of female sandflies that are infected with the disease, which as they bite another organism, they may infect them with the Leishmania parasite. Another way of transmission is through blood transfusions with an infected person. Where does it live? The Leishmania parasite is known for using dogs or other animals as reservoirs. Cutaneous leishmaniasis. Cutaneous leishmaniasis is the most common manifestation of leishmaniasis. The symptoms, which are usually painless skin ulcers, might become apparent only after some weeks or months. Mucocutaneous leishmaniasis. Mucocutaneous leishmaniasis is a bit more dangerous, as it targets the mucosal membranes of the nose, mouth, and throat. The symptoms, which are ulcers in the mucosal tissue, stuffy nose, nosebleeds, and difficulty breathing, may only appear apparent after 1 to 5 years after getting the bite. Visceral leishmaniasis. Visceral leishmaniasis is the most deadly manifestation of leishmaniasis, as it targets specifically the vital organs. The symptoms are enlarged liver and/or spleen, fever, anemia, weakness, and weight loss. History of Leishmaniasis. Leishmaniasis has no clear person that first discovered it, as it only has been documented by and described by many people and many civilizations over the time. Where has disease affected historically? Historically and in the present time, this disease has affected the Amazonian region, the Middle East, Central Asia, and the Indian subcontinent. Diagnosis. Diagnosing leishmaniasis usually consists of either a bone marrow biopsy or a blood test similar to dengue. How has science been applied? Science has been applied in many manifestations, but one in particular is paromomycin, which is an antimicrobial which is used to treat a large array of diseases, and it is usually injected or orally administered. In leishmaniasis, it is usually in a 20 to 21 day treatment, but this depends on your case and your doctor. The recovery time is almost mostly dependent on your case, as each person recuperates in a different time. How does paromomycin work? Paromomycin works by attaching to the ribosomal RNA and increasing the error rate of the previously mentioned. If treatment is not available, this usually depends on the type of leishmaniasis. Cutaneous will usually heal on its own, but it may take up to several years. Mucocutaneous, if not treated, is very dangerous, being life-threatening. While visceral would almost always mean death, as 95% of cases of visceral leishmaniasis have not been treated have been perished. Economic implications of using science. The pros of using science from an economic point of view are that it permits people to go to work, which permits them to make money, but the cons of science is that the treatments aren't usually in the budget of people with economic troubles, which are the ones who are usually affected by leishmaniasis. Social implications of using science. The pros of science at a social level is that it permits you to be a member of society, while the cons are the severe side effects of paromomycin, which means you probably will not be able to go outside or be around people because of those. Information sources are 8, while image sources are 16 images. You can copy the links over here. Thanks for watching.